Welcome to the Cystic Fibrosis Foundation CF Education Day, Cystic Fibrosis-Related Diabetes, Illness, Transplant, and Pregnancy. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Foundation and supported through an unrestricted educational grant from Genentech. To learn more about CFRD, CF research, lung health and lung disease, please watch an archived webcast on the Foundation's website. This particular broadcast will present information about CF-related diabetes when you're ill, during pregnancy, or considering transplant. Questions not related to this topic or that ask for medical advice will not be asked or answered. If you have questions, I strongly encourage you to talk to your doctors and staff at your care center, or you can contact the Foundation at 800-FIGHT-CF or info@cff.org. Joining me to talk about CFRD with illness, transplant, and pregnancy are Dr. Tony Moran and Carol Brunzell of the University of Minnesota. Tony is a professor and the division chief of pediatric endocrinology at the university. She is also the leading expert and researcher in the United States on CFRD and was a co-leader of the 2010 Clinical Care Guidelines for Cystic Fibrosis-Related Diabetes. Carol Brunzell is a registered dietitian and certified diabetes expert. She's spoken to many healthcare professionals about CFRD, as well as being a part of the 2010 CFRD Care Guidelines. Both Tony and Carol are also co-authors of the 5th edition of Managing Cystic Fibrosis-Related Diabetes, an instruction guide for patients and families that are available on the Foundation's website. So welcome, Tony. Welcome, Carol. So the first question that came in was, why are blood sugars high when a person with CF is sick?
Okay, and that's certainly a common thing. So there is this vicious cycle. When you are ill, or when you are given a high dose of steroids, which usually happens when you're ill, the two usually go together, that makes you insulin resistant. So the illness and that stress on your body makes your body not use insulin well. The body will try and compensate for that by making more insulin. But if you're someone with CF, maybe your pancreas is already making as much insulin as it can just under normal circumstances. So it can't make enough insulin and the blood sugars get high. Once your blood sugars are high, that feeds the infection. So bacteria love high blood sugar. And so then you get this cycle going that being ill makes your blood sugars high, but the high blood sugars keep you ill.
And so, having steroids and illness and CFRD, it just doesn't all doesn't work well together. Right.
So they both increase your insulin needs, but if you can't do it, your blood sugars get high. And so the time that diabetes is often diagnosed is during an acute illness, or there are patients who just need extra insulin during each acute illness, during each steroid burst. Maybe in between they don't. But it's important to find those times when you need insulin, because it'll also shorten the period of time that you're sick. When you're sick, maybe the last time that you want to deal with anything else. You just don't feel well, but you will feel better faster if you get the diabetes taken care of.
So let's change to transplant. Someone wanted to know, do blood sugar values have to be perfect before a person with CF will be considered for a lung transplant?
So if that were the case, nobody would get a lung transplant. Almost all patients who need a lung transplant, the vast majority have diabetes before the transplant. And almost every single CF patient has diabetes after transplant, just because of the medications that you get after transplant. Certainly you want your blood sugars to be in as good control as possible before transplant, because you want to be as strong as possible going into transplant. You want your nutritional status to be good. You want your infectious status to be as under control as possible. So yes, you want to strive for really good control of diabetes, but it's not going to keep you from getting a transplant.
Well, that's good. What about CFRD after transplant?
So actually, after transplant, essentially everyone has diabetes, but it's much easier to take care of because you don't have that insulin resistance. You don't have all that lung infection. Your nutritional status tends to be better. So diabetes tends to be easier to take care of.
Well, that's good to know. Let's switch again to pregnancy. So what is the role, how is CF-related diabetes and pregnancy? Can those two happen at the same time?
Yes, they certainly can, and we have managed many women successfully through their pregnancy with healthy babies. But it's important to understand that if you are planning to get pregnant and you already have CFRD, it really is important that people discuss this ahead of time with their doctor and their diabetes care team. And the reason for that is it is very important for normal development of the baby as well as the mother's health to have their blood sugar in really, really good control. And the blood sugar goals are stricter or tighter than they are just for just in general CFRD. So they also need to know that they're going to need to check their blood sugar more frequently during pregnancy. So women will need to check before each meal and 1 or 2 hours after, depending on what their doctor recommends. So it's quite a number of tests per day. So all of these things, need to be discussed ahead of time. And so again, for the best outcome, it's important for that mother to be able to successfully do that.
So someone asked, she only has, her blood sugars are only a little bit high in the morning. CF-wise, everything is good. What is she, when she gets pregnant, going to have to go on insulin?
So women who have CF but not CFRD are at a very high risk of developing what we call gestational diabetes or diabetes during pregnancy. And again, the nutrition recommendations are very different. So it's important that, that they understand this. Women who don't have CF and develop gestational diabetes are very, very commonly restricted both in calories but also in carbohydrates. And that is not true for women with CF who develop gestational diabetes. So it's important once a woman is diagnosed with gestational, and she should be getting regular screenings as well according to the recommendations, that she meet with a CF dietitian right away, a diabetes dietitian, and learn about carb counting and how to eat a healthy diet that has adequate calories and fat and protein and sodium. The only thing that we ask is to really cut back or stop drinking sugary beverages like regular soda and put some limits on the amount of fruit juice, simply because they don't provide enough other nutrients and calories to sustain a healthy pregnancy or get the weight that's necessary. But insulin is necessary if blood sugars aren't being met and or if a woman who is pregnant has trouble gaining weight. And oral supplements are freely used, again, Boost, Ensure, whatever they are tolerate. So they can also be used in order to help with adequate weight gain. That's the bottom line, is to get that weight gain with the recommended guidelines for the best outcome for both the mom and the baby.
So you mentioned having a diabetes ID, and actually somebody wrote in and wanted to know, where can I get a diabetes ID?
Right. Well, what they can do is they can go through the American Diabetes Association website, and certainly you can find a link there that will help them get an ID, or you can ask your diabetes educator. They usually will have reference forms or materials in their office to help you find.
And someone else wanted to know, is it okay for someone with CF-related diabetes to use artificial sweeteners?
Yes, it is. However, really the only thing I ask people to change is to switch from regular soda to diet. Artificial sweeteners are not harmful, but we don't want them to use artificial sweeteners at the expense of calories, because anything can be covered with the appropriate amount of insulin.
So any tips for people who are in these special situations related to illness, transplant, or pregnancy?
Just that insulin needs are constantly changing. You think you figure it out one day, and then the next day it's different. So you have to test. Testing is the only way you'll know if you're getting enough insulin, if you're getting the right amount of insulin. And doing that will help you get through the illness better, will help you feel better, faster, work closely with your doctors, but also know that they are training you so that you get the confidence that you can make the changes yourself.
So just some couple last questions. I know we talked about this earlier in this broadcast, but just for clarification, is there anything people can do to prevent from getting CF-related diabetes, like not eat as many sweets or exercise more?
Nothing.
Okay.
The scarring that takes place in your pancreas is totally independent of what you're eating, how you're exercising. There is nothing you can do to prevent diabetes. So live a healthy life, eat the food you like, get good exercise because it's the healthy thing to do, but not because it'll stop you from getting diabetes.
Okay, so 2 last questions, kind of on the same perspective. If there is a cure for cystic fibrosis, will that mean a cure for CF-related diabetes? And how do these new drugs, the VX-770, VX-809, how might that affect CF-related diabetes?
So it's a really interesting question that nobody knows the answer to. We know that the CFTR channel is present in the cells that make insulin. If we fix that channel, could we prevent diabetes? We are just now talking about studies to look at that.
So that's great. And thank you, Tony, and thank you, Carol. This has been a wonderful discussion about CF-related diabetes and what people should know. You can read some of the frequently asked questions about CF-related diabetes on the Foundation's website under Living with Cystic Fibrosis, Staying Healthy, and click on CFRD. This is also where you can find the instructional manual about how to manage CF-related diabetes. You can also read the CF care guidelines for cystic fibrosis-related diabetes in the treatment section under CF care guidelines. Click on nutrition/GI, and then you can read what is recommended for CFRD care. To learn more about type 1 and type 2 diabetes, you can go to the American Diabetes Association website at www.diabetes.org and click on Diabetes Basic. Also, this is where Carol said you'd be able to find your diabetes ID. This concludes our virtual CF Education Day webcast about CF-related diabetes. I would like to thank you for watching, Tony and Carol for answering the questions that we had come in, Rick Vasta and the technical crew, Melissa Chin, Genentech, and the Cystic Fibrosis Foundation for making this webcast possible. Thank you very much.